Hi everyone. Today let us discuss about the plasma protein binding. So the four important things which you should remember with respect to the plasma protein binding is what happens with respect to the duration, with respect to the distribution of a drug, and third point is with respect to the displacement, and fourth with respect to the dialysis. So as you can see here, with the duration, so those drugs which are having high plasma protein binding capacity, they will act for a long duration, so they are long acting ones. So those which are having low plasma protein binding ability, they will have a short acting ability. So what happens with respect to the distribution? So those drugs which are having high plasma protein binding capacity, what happens to the distribution? There will be low volume of distribution. So whereas with respect to the those drugs which are having low plasma protein binding capacity, they will have high volume of distribution. So what happens in case of the drugs which are having high plasma protein binding capacity with respect to the displacements? So with respect to the displacement, the drug which is having a higher plasma protein binding capacity can displace the other drug from the plasma protein, and it can lead to increase in the concentration further, which leads to toxicity of the other drug. So what happens in case of the low plasma protein binding capacity? So these drugs will have low displacement reactions, as well as they have low drug-drug interaction. So what happens with respect to the dialysis? So those drugs which are having high plasma protein binding capacity, they are very difficult to remove. Whereas those drugs which are having low plasma protein binding capacity, they are easy to remove by dialysis. So this is a very basic thing you should remember. So again, with respect to the volume of distribution, here you can remember that if there is a low volume of distribution and a high volume of distribution, so among this, which is the group of drug which can be easily removed by dialysis? So those drugs which are having low volume of distribution, they are the candidate for dialysis. They can be easily removed by dialysis. So these are not effective. So the drugs which are highly distributed will not be a effective candidate for undergoing dialysis. So which is the drugs which are not effective for dialysis? Drugs not effective for hemodialysis or a dialysis is, you can remember by a name, avoid dialysis. So A stands for your amphetamine, V stands for your verapamil, O stands for your organophosphorus group, as well as you can remember it is opioid group of drugs. I stands for it is imipramine, which is a tricyclic antidepressants, and you have got the digitalis, and one more D stands for the diazepam. So these are the drugs which are not effective against the treatment of dialysis. So if you find this video useful, please do subscribe to my channel. I love pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you. And it's very important topic which will be asked in your exams many times. So this concept you should be clear. So the first concept being, so you should remember with respect to the duration, with respect to the distribution, with respect to the displacement, with respect to the dialysis, and with respect to the volume of distribution, which is the candidate for the dialysis and which is not the candidate for dialysis. And these are the examples for the drugs which are not effective candidate for the dialysis, like A for amphetamine, V for verapamil, O for opioid and organophosphorus poisons, and in case of imipramine, digitalis and a diazepam. Thank you.